Thanks for joining this video today. So today we are going to talk about the DBLG1 closed-loop system, which is also known as the Diaboop system. And for the first time, I will share the results of the French pre-launch of the system after a 6-month follow-up of 25 patients with type 1 diabetes. I am Dr. Coralie Amadou, and I present these results on behalf of the Diaboop Consortium. I have to mention an ad hoc consulting agreement for this presentation. So, in previous clinical trials, the DBLG1 closed-loop system was associated with a significant glucose control improvement and a significant reduction of time spent below range or in hypoglycemia. And in one of those clinical trials, the system has also been tested in challenging real-life situations, like for example in patients exposed to gastronomic dinners. And once again, the system showed its superiority versus conventional insulin pump. So, beyond safety and efficacy of the system that were previously validated, the goal here was to assess the real-life use of the system in real-life conditions. And this was done on a population of 25 patients with type 1 diabetes already using a conventional insulin pump and a glucose monitoring device. So the exclusion criteria were age under 22 years old, pregnancy, and a total daily dose of insulin under 8 or above 90 units per day. The primary outcome was the time spent in range according to international guidelines, and the secondary outcomes were HbA1c, time spent below range, and of course, safety of the system. So the system included an insulin pump, Kaleido insulin pump, continuous glucose monitoring with Dexcom G6, and of course, a terminal running the algorithm. So after an open loop period of 1 to 2 weeks, which was the control period, the system was initiated in closed loop. Data were collected on a cloud platform called Your Loops and were retrospectively collected in 2 centers of this French pre-launch. So here are the characteristics of our patients. So the mean age was 43 years old with a mean duration of diabetes of 19 years. 76% of those patients were women, and at baseline the mean HbA1c was 7.9% and the mean percentage of time spent in range was 53%. So here you can see the individual trajectories for the primary outcomes, time spent in range. So notice that at baseline, only 2 patients were in the recommended target, and after 6 months, there were 14 to be in it. So the mean percentage of time spent in range significantly improved from 52.5% to 69.7%. And in the meantime, the HbA1c significantly decreased from 7.9 to 7.1%. For the time spent below range, the total time spent below 70 mg per deciliter significantly decreased from 2.4 to 1.3%. The time spent below 54 mg per deciliter didn't significantly decrease, and the BMI and total daily insulin dose didn't significantly change over the period. Finally, for safety, only 1 patient decided to stop using the system after 2 months because of repeated disconnections, and therefore this patient was not included in the 6-month analysis. For the percentage of time spent in closed loop, in total time, this percentage was 85%. And when looking only when the Dexcom G6 was operating, this percentage was 92%. In our center in Corbeil-Essonnes, 1/2 of our patients had to change their Dexcom sensor at least once before the scheduled date, and 1/4 of our patients had to change their Kaleido pump. No severe adverse events occurred, and none of these events required any medical intervention or hospitalization. To conclude, this is the second report of a hybrid closed-loop system after those of Medtronic closed-loop system. Only one patient decided to stop the system over the 6 months period. Glycemic control significantly improved with no serious adverse events. So this pre-launch confirmed the safety, reliability, and efficiency of the DBLG1 closed-loop system.